Propranolol, also known by the trade name Inderal. Propranolol is indicated for the treatment of hypertension, angina, arrhythmias, cardiomyopathy, alcohol withdrawal, and anxiety. Propranolol works by blocking both beta-1 and beta-2 adrenergic receptors. The therapeutic classification of propranolol is an antianginal, an antiarrhythmic, or class 2 antiarrhythmic, an antihypertensive, and a headache suppressant. And the pharmacologic class is a beta blocker. Special considerations for nursing include a contraindication in starting in acute heart failure, pulmonary edema, cardiogenic shock, bradycardia, and heart block, particularly second and third degree heart block. Patients on propranolol should have hemodynamic parameters such as heart rate and blood pressure monitored closely, and propranolol may cause bradycardia, exacerbate CHF, and worsen pulmonary edema. Propranolol may also mask symptoms associated with diabetes mellitus. It is advisable to change positions slowly in patients on propranolol, as it may cause orthostatic hypotension, and patients should be instructed on how to take their own blood pressure readings at home, whether it be with an at-home meter or at their local pharmacy. It is important to taper off of propranolol, as with all beta blockers, as sudden withdrawal can result in possibly life-threatening arrhythmias. Patients with CHF who take propranolol should have their intakes and outputs monitored daily. And, as it is a non-selective beta blocker, patients should be advised to notify their physician if they experience any trouble breathing. This is particularly important in patients with asthma, where propranolol use should be very cautious, if not avoided. It is important that patients be instructed to report any major diet changes to their physician while on propranolol. This is because switching to a high protein-rich diet may increase the bioavailability of propranolol by up to 50%. This has led to increased propranolol levels in the blood and increased rates of side effects in some patients.
This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.